Hey team, hope you're all doing well. Welcome back to our REDCap training sessions. Today's session we are going to be focusing on a mock scoping exercise using our REDCap scoping form that we've created. But first of all, before getting into the nitty-gritty of the scoping form, I just wanted to talk you through a bit of the background logic into how we get to the scoping form. So a case notification will come through as per normal, where the SSOs receive a direct lab notification. Then the SSO will then update EpiServe and create an NDCMS record for the case. The case details entered into NDCMS are then automatically uploaded to the REDCap initial form. So the REDCap initial form is used as a reference point for differentiating between our cases and contacts, and it also allows us to store all their demographics and link the case up with other forms or with other logic that requires them to remain on the daily symptom checks, or to discontinue daily symptom checks because they've met the clearance criteria and have been cleared by an MO. Then also the case assignment will occur kind of like in conjunction with case notification and the initial form being set up. So a quick, yes, that's right. And then you would receive a link, an email from REDCap with a link directing you to the scoping form here. Let's go back one. Directing you to the scoping form here. What else? Cool. Okay, so a bit of a case overview for today. So it is an overseas acquired case, confirmed COVID-19, and the case is returned home to Auckland from Sydney, Australia after a 2-week holiday with family. The case has one household contact, which is their flatmate, and one casual contact who the case and the household contact met up with at a local cafe for lunch. When we're going through the scoping form, you'll see that you can just add in whatever travel dates you like, just like a random phone number, address, GP name and contact number for them, and also an occupation. Keep in mind that this is for training purposes for today, just to get you just to familiarise yourself with the scoping form. So once you click on that link, sorry, let me get that out of the way. Once you click on that link here to the scoping form, it'll take you to this lovely looking form here. Please bear in mind that I have pre-entered the details into the scoping form, but if at any time you feel like you need a bit of a refresher, come back to this recording just to get you back up to speed, or just as a little reminder. So at the top of the scoping form we just have some general information for the case and contact management team member. Here in this line would be the case's EpiServe number and then the case's name. For today we are interviewing Raven Baxter. So we also ask that at the end of the scoping session, at the end of the interview, that you download this form as a PDF and add it as an attachment to the case's NDCMS file. Here in red we have just some generic quick access contact details for the case so that we're not fluffing around in between files and folders. You'd enter today's date. Oh, actually, sorry. I done this yesterday, so that's why it's got the 23rd of the 6th. You'll then enter the EpiServe number, identify that they are a confirmed case, and what date that they were reported to us. And then select the team that you are in as a case and contact team member. Today I'm in team 4. and also notify that the GP has been informed and what time. The good thing with this is that these sliders down here allow you to just choose a specific time. Cool. So date and time of first contact attempt. You'll get those details here. Date and time of interview. Your name and your email address. If the interview is being completed with a case, we would select yes. If not, we'll select no and fill out these details here. What we've added into these REDCap forms is this little bit here, must provide value, which means that which just means that you can't carry on or like complete the form until all these fields are completed. We'll make sure that all our privacy information is given. Here, if an interpreter is required, yes, we have this information here and contact numbers to ring to organise that. Then we go into our ID, our case ID details. These bright blue demographics here, these have been pre-populated from the initial form, and we'd just like people to, if these names are correct, then we would like you guys to still add them in. However, if it's wrong, please make the corrections here, and this will be amended in the initial form. We'll then add the NHI number and their date of birth. So you see here we've got, please confirm date of birth is the 24th of the 5th, 2020. It is actually 24th of the 5th, 1992. So that amendment has been made there. We have confirmed that she is a female, her ethnicity, and her current address. For today, I've used 40 Claude Road in Epsom. Confirm the contact numbers, and again, these can be just copied and pasted from up here if you like. And then confirm her email address. Email address is really important in this case, especially if Raven chooses to go down our electronic symptom checking pathway. Then we're talking about, then we're going to go into our occupation details. So again, first of all, if she is in a high-risk occupation setting, but today she does not work in any of the high-risk occupation settings, but for example, if we were to choose education, we'd have these extra questions pop up here. Same with healthcare and aged care facility. So add in her occupation, employer, which is place of work because it's neither a school or ECC. Write down the name of the location here, the address. And if your case has any other occupations, feel free to add them in here. We then add details of her GP. Use your country of residence for them if it's not New Zealand, and also what kind of passport they hold. Now moving on into underlying conditions. If your case has any underlying conditions, please identify them here, and then if none of those conditions are specified here, you have an option to write it down here in the risk factors for disease. Sorry, if you tick other, then this question will pop up here for you to specify, and then you can also add any other risk factors for disease. Cool, so here we're just identifying how the case or the infection was discovered. But today it was that Raven became ill, so seeking healthcare due to suspicion of COVID-19. Raven was tested at a CBAC testing centre, and it was a self-referral, and full PPE was used for swabbing. If not, you can definitely select no and then write down the extra details here. Actually, it'll be good to note here, so for all our text boxes that you will see throughout the form, they have no character limits, so feel free to add in as much or as little detail as you need. Then we're going into the basis of the diagnosis. Again, we've got some more required fields, which you can't complete unless these are done. So, case this obviously has been symptomatic. Swab was taken on the 20th of June, and the onset of the symptoms was the 19th of June at 5:30 in the morning. We've identified all the symptoms that she's experienced here, and we're able to comment on the severity or the duration of her symptoms. You're also able to enter the highest temperature I've taken, and also identifying if she fits the clinical description. We've got information here regarding hospitalisation and death. So for today, Raven was not hospitalised, nor has she passed away. However, if she did, later on, during the investigation, or in the next few days or something like that, we're able to come back to this form and add those details here. Now we're just identifying in terms of her isolation, self-isolation, and if she was in self-isolation at the time of the onset. No. And then we're just going into a timeline 14 days prior to the onset of Raven's symptoms, which was on the 19th of June. So just keeping in mind to consider all all possible scenarios and taking into account date, time, how long your case may have been in these premises, meetings, high-risk occupations or high-risk settings in any institutions, and who they had worked with on that day if they did attend work 14 days prior to during any of the 14 days prior to the onset of symptoms. Here we've got our text boxes again. We have no character limits, so you can add in as much or as little detail as possible as you'd like. Making sure that we have date in there, what the case was doing, and also the time. So here on the 18th, the day before she became symptomatic, the case was at work. And she had also met with her flatmate and her friend at a local cafe for lunch at 12:30, where they were there for an hour, leaving at 1:30. So for the purposes of this training session, I won't go through every single day, but you kind of get the idea of how this part works. Raven didn't have any contact with a lab-confirmed case or probable case, and she is not involved, and she is not included in any of our outbreaks. If she was, however, we can specify the outbreak number and the name of the institution. So trying to figure out the source of her infection. So she has had overseas travel. The reason for travel was because she was visiting family, and then we're just adding in the date that she arrived back in New Zealand. Oh, no, can't see that. Oh. Remembering that we can use these sliders here to choose a specific time. Okay, I will just do this. So I'm just going to put this back to what it was before. Okay, so then we go on to asking how many countries did the case visit during the 14 days prior to onset. We have an option here to choose as many countries as we like. For today's purposes, there's only one. However, if she did go from like New Zealand to Australia and then on to maybe Rarotonga and then back to New Zealand, we can add in 2 here, and then 2 sections will become available for us to complete. Oh, no, wait, no. Okay, let me just do it. So, Australia. Okay, so how many flights? Again, same as the countries. If she took 4 flights, we would select 4, and then 4 sections will pop up for us to complete. But she only took 2 flights. And then we'll enter in the flight details here. Flight number, the date of departure, and then the seat number. Cool, so maybe your case if they had visited some healthcare facilities, you would select yes. And then you'll just enter in the name and the date, the name of the facility and the date that they visited. If you had any contact with anybody who had with a respiratory infection, you can indicate that there, and then the kind of like the interaction or the description of what had happened. Now we're going into identifying any contacts. So first we need to identify how many days it has been since the case's onset date. So when I was filling this out the other day, it had been 4 days since the onset of the 19th. And then we would just list any activities or the whereabouts, whereabouts, activities, and things that the case had been up to in these days, during these days. So you can see that here. Identify the day, the date, the time, and so forth. So we've got our onset date here. Time and date is pre-populated from our onset date that we entered earlier in the questionnaire. And then we're going back 24 hours prior to onset. And then we're going the days post-onset till the day that we are completing the scoping form. And we're just going into household contacts. So we ask, does the case have any household contacts? Yes. And then we've got household contact 1 pop up where we would enter all the details of the household contact. As you can see here. And then so say we've got a family of 6. So we need to add in another household contact. We would click yes. Household contact number 2 would come up. Again, yes. Household contact number 3, and so forth. Cool. And so we don't have any other household contacts, so we will select that. Now we're going into other contacts. So for Raven, she does have another contact, which is a friend that her and her flatmate Karen met up with for lunch on the 18th. So we're saying yes here, entering the details of the other contact, and being quite specific on the contact group type. So in terms of being specific is that, so the cafe doesn't fit into any of these categories here, so we chose other, enter the details, Epsom Cafe, and make sure we were very specific on the date and time of exposure. So these three sections here will help us with creating contact groups in NDCMS for the exposed contacts. We don't need to add another contact because she hasn't had contact with anyone else. Now I'm going into institutions. So did the case live or attend one of the following most infectious? So the case was at work on the 18th, so I've selected that. We've come up with some more questions in terms of workplace and added those details there as required. Now, if she was at the workplace during the day and then went to uni after work, you have the opportunity to select more than one option here and enter these details here. Once this is completed, you will then receive a link to our institutions form for you to fill out, for you to contact the principal of the primary school, the centre manager of the childcare centre, or any one of our single point of contacts for these institutions, and complete the institution form with them. I'll come to that later. Now we're just talking about our case management. So where is the case's isolation happening? Where will the case be self-isolated? In this case, she'll be at home and has been self-isolated since the 19th. We've provided some more health education advice around isolation, and advice if she requires to seek any further medical services or assistance. We also have welfare, so making sure that we ask or identify if there are any welfare or cultural support that's required by the families. And offer that for both Māori and Pacifica people to be able to link in with the support services that we have in line for them, and also if the house is overcrowded. Now we're going into so future follow-up method really focuses on symptom checking and what pathway is most appropriate for the case, or what pathway that the case prefers to follow. So we have our manual symptom checking pathway and also our electronic symptom checking pathway. So for Raven, we've chosen that she's preferred to carry on with our electronic symptom checking, and she consents to this. So we take her email address and write it in here, confirm it below, and so if the case does choose to continue with manual symptom checking, you'll select no, and then you'll put then as interviewer, you'd put the email address of your case and contact management team, the generic email address for your team. But for today, because I want for testing purposes and because I want the symptom checking form to come straight to me, I've put my email address in there. Now we'll come to pretty much the end of the scoping form. So at this point, you could just finish up the interview here and just end the phone call with them here. And then once that's all done, you'll just come to this summary for the summary section, and write in a progress note of the interview and how that went. This will then be copied and pasted into the NDCMS file or as progress note, and then also outline any outstanding actions that need to be completed. Cool, so you will then select submit. Take note of the return code just in case we need to come back to this form at any time. Actually, a good point is you could either copy and then paste it into as another progress note in the case's NDCMS file and just write scoping return code. Yeah, that's actually a good idea. And then we would then go in and download the PDF. Which will look a little something like this. Cool. And then download it. Apologies. And then save it into InDrive or on your desktop, and then add it as an attachment into the NDCMS file for the case, and then just stick it on your desktop. Awesome. So that's that is that's pretty much the end of our scoping form kind of training session run through. If you do have any other questions, please feel free to come in and see myself or Taylor. We're in room 12 on level 1, or just feel free to flick either one of us an email. If you have any questions, or if you just need us to clarify something, if I wasn't clear in this video. But yeah, hope all goes well with your scoping and using the REDCap forms. Cool. Awesome. Thanks, team.